Okay, this is nursing research week 1. We will study what is nursing research. Actually, it is a systematic process that uses rigorous guidelines to produce guidelines or to produce unbiased, trustworthy answers to questions about nursing practice. Okay, so let us focus on its definition. Okay, what is the definition? It is a systematic process of inquiry. Okay, by the use of guidelines. This is repeated statement. Okay, so to produce unbiased, trustworthy answers to questions about the nursing practice. So basically, we are doing research to refine nursing practice, but it has to be unbiased. It has to be trustworthy because our main goal or our calling as nurses is to save the lives of the people we care for or our patients. Next. Okay. So we have the purposes of research. Number one is to synthesize the findings of others because when we do research, we have to read review of related literature, the work of other authors. We summarize those findings for us to create conclusions out from these findings or for these findings to guide us in making our study. We are also exploring and describing phenomena that affect health. So when we say a phenomena, it is a context wherein there is a nurse or a patient or any nursing scenario that you wanted to explore, you wanted to know more about, or you wanted to describe for you to be able to understand those phenomena that happens in the nursing profession. It is only done through research. And through research, we find solutions to every problem that occur in the nursing field. For example, the occurrence of the COVID-19, we have adjusted a lot from the scope of responsibilities of the nurse, from the way we deal with our patient, we deal with the disease, we deal with other factors, or even the way we deal with our lives. So through research, okay, it is again the only way for us to find solutions to these problems or even the simplest problem that could occur in the clinical area, not only in the diseases of the patient, but it could be from the relationship of the patient to the nurse, nurse to doctor, and to the other member of the healthcare team, or anything that occurs in the nursing field. It is our way of testing traditional approaches to patient care for continued relevance and effectiveness. For example, when we try the interventions that are used in the hospital, we may see that those some of those interventions are traditional and not or are no longer effective in our world today. Like for example, when you have a fever before, they will just give you skyflakes and an orange juice and you will be okay, or they will just be giving you a jacket or a linen to cover you and you will just perspire and your temperature will just go down. But now, evidence-based practice, okay, evidence-based practice, the WHO and the product of research will now tell you that when a patient is having a fever, you should not be giving them blankets, but you have to open or you have to remove the clothes of the patient so that the temperature would evaporate and the temperature would go down. So it's a different thing. Another example, if the patient will deliver in the clinical area, you should be positioning the patient in the lithotomy position or supine position while waiting for the labor to come. Okay, but now when you let the patient to go inside the delivery room, you should be positioning the patient into as upright as possible to get away from the effect of gravity to the fetus going down in the birth canal. So there are a lot of traditional approaches in the hospital that are no longer applicable to the present times or in the contemporary times. We also have here what we call as peer review, blinded review, and replication. When we say peer review, it is one way of selecting or appraising a study that could be suitable for conferences. So they would not know who you are, your school, your mentor, and they will just select your research study if it's suitable for the conference or not. When you say a blinded review, it is a type of review in which the peer reviewer is unaware of the author's identity. So personal influence is avoided. So it's just like doing also the peer review. We should be unbiased for us to, we should know who is, we should not know who is the author. So we could be selecting the study based on its substance, not based on who is the author. When we say it's a replication or a replicate study, it is repeating a specific study in a detail on a different sample. Okay, you could use the same questionnaire, you could use the same design, okay? But the study is done in different time with different participants or different respondents, and that is what we call replication. Actually, you could have the same title of the study, but it should be done in another situation or another or other participants or respondents. When we say participants, we uh, we mean qualitative, okay? When we say respondents, we mean quantitative. Next, we have okay, what are the importance of research in nursing? Okay, so what are the importance of research in nursing? We have here providing strong evidence for informing nurse decisions and actions. So this is the only way for us to refine nursing practice. Research will continually guide us to give interventions to our patients that are evidence-based. Okay, it will provide high quality of nursing care. Yes, it continually improve what has been practiced in the hospital, not only in the hospital, but in every nursing scenario. When we say nursing scenario, it could be in the academy, it could be in the community or anywhere the nurse works for certain clients or an institution maybe. We also elevate the standards and reputation of the nursing profession because, again, nursing is indispensable. We save the lives of people. So, in order for us to elevate the reputation of the profession, we should be applying evidence-based practice. When we say evidence-based practice, it is actually the blending of the patient preferences or patient values, clinical expertise and research. Okay, that is what we call the EBP. And the first theories who practice evidence-based is Florence Nightingale, when Florence used soap and water to clean the wound of the wounded soldiers in the Crimean War. And that was the first time that EBP was practiced by a nurse. We are also able to increase the body of knowledge because the findings of research or the results of research could um, be applied to the nursing profession to improve the knowledge that we have and for us to improve the care that we give to our patients, for us to be able to give optimum care to them. Okay, we also have here improving personal and professional development through research. We will be knowing a lot of things. We will be aware of the things that basically a civilian or a person who is not a nurse would not know. Okay, so it's through research that we could um, enhance, improve our personal and professional development, our ability to understand people, our ability to understand um, um, the interventions that we're doing in the hospital, and our ability, of course, to intervene properly to our patient. Next is we have here the research purposes and the type of research questions. Actually, in the next lessons, we will be dealing with the different designs or whatever are the purpose of these designs. For the purpose, if it's a quantitative research, it's for the identification. Um, it's a blank because you are not really, for quantitative research, the identification of or the type of question is from a questionnaire. But for qualitative research, you will be asking about the phenomenon and what's the name of the phenomenon. So you will, for example, you will be after the lived experiences of nursing students in their first time in the clinical area. So that could be the phenomenon, their first time in the clinical area. In description, in the quantitative research, you have to know how prevalent is the phenomenon, how many times, for example, dengue is occurring in every year, or how often does a phenomenon occur, or what are the characteristics of the phenomenon, or what are the variables related to, for example, the prevalence of dengue. And for the qualitative research, what are the dimensions of the phenomenon? What is important about the phenomenon? So what is all about the experience of those students in their first time in the clinical area? So what is all about this? What are the gaps that you're trying to fill in? Why do you have to study this? For exploration, for the quantitative research, we have here what factors are related to the phenomenon, what are the antecedents of the phenomenon, and even the consequences of the phenomenon. So you have to explore the variables related to the phenomenon. Okay, we will be talking about the independent and the dependent variables later on. And in qualitative research, what is the full nature of the phenomenon and what's really going on here? So in qualitative research, as you have noticed, it is an in-depth exploration of the phenomenon. Unlike in quantitative research, that you will be just using the positivist perspective for you to be able to understand what is all about that phenomenon, or you will be just using statistical tools to finally present the results or of the variables in that phenomenon. For prediction and control in quantitative research, of course, you have here the experimental research and the quasi-experimental. Okay, so you have here, you will be repeatedly hearing the words X and Y, and of course the alteration of the prevalence. For example, if you're after the prevalence of a disease, or can you be able to prevent or control the phenomenon if you will be doing a predictive, quantitative, than experimental design. So that is for the prediction and control ability of a quantitative research. But for explanation, for quantitative research, what is the underlying cause of the phenomenon or the causal pathway through which the phenomenon unfolds, or does the theory explain the phenomenon? So in here, longitudinal studies or panel or cohort design will be very applicable in knowing this or answering these questions. But for the qualitative research, how does the phenomenon work? Why does the phenomenon exist? And how did the phenomenon occur? So as you have noticed in qualitative research, it is in depth. Okay, for the quantitative research, you will be using or after what you call as the positivist perspective. Okay, positivist perspective, but for the quantitative, you will be on a postmodernist perspective. The postmodernist perspective, again, is when you believe in multiple realities. Okay. Next, we have the roles of nurses in research. Of course, you have a function. Okay, you have your participation here. If you will be, for example, a respondent or a participant in research, okay. Actually, there are a lot of research that needs a nurse like to be a participant. Like for example, I will be studying on nepotism or political backing in the government institutions. Okay, you could be one of the participants. Okay, or a nurse could be one of the participants or respondents in my research. So as a nurse, we need to have some awareness of the process and language of research. That is why I am now teaching you that when you say participants, we mean qualitative. When you say respondents, we mean quantitative. When you say hypothesis, we mean quantitative. When you say assumption, we mean qualitative. So that is being aware of the language of research, because as a nurse, you should know what these um, terms are, or what are the meanings of these terms. For example, you do not say uh, researches, okay? You say research studies. Be sensitive to the issues related to the protecting or protection of the human rights or the rights of humans. So when you do research, you will not just be experimenting in human beings. Okay, you cannot do that. When you try to experiment um, an intervention through a true experimental research, then you could use guinea pigs or rats, but not really humans, because they have the rights. Okay, in research, like for example, they wanted to withdraw from participation or in the participation of the research, then they could just withdraw. Or for example, they wanted that the things that they have said in the interview will be opted in the research, they could just do that. Or if they want to participate, then they could also do that as well. Okay, so but we have to give them the WHO informed consent in doing research before we finally involve them in our research as a respect to their rights as a human being. And of course, you should be very discriminating consumer of research findings. You should not be believing in everything that you see. For example, you have seen a finding of a research in a journal, then you would try go back to the design, go back to the objective of the study, go back to the statement of the problem. Are they congruent? If not, then there is a problem with the findings and results of the research, and you should not be believing in that result. Okay, so you should be very discriminating, or you should know what to believe in, and you will only know that if you know how to do research that is aligned or congruent to the purpose of what you are studying. Research is critical in nursing for the following reasons. The use of research is inherent to the definition of the profession because we could not go away from research every now and then. The nursing profession needs a research to be done for us to be able to, again, refine nursing practice, refinement of nursing practice to better our decisions in dealing with our patients. Nurses are accountable for outcomes, whatever happens to your patient, and it's your liability. You could not just say that the patient is dead. I did not do anything, or the patient um, is sicker now, and I did not do anything. No, it's your liability. So if you did not apply an evidence-based practice and something happens to your patient, then you will be liable for that. In the Philippines, we have the nursing law that will be affecting you. Okay, so you have to be very accountable to everything that you do. My dear students, you should not be guessing the vital signs of the patient. They will all die. Okay, you have to get the vital signs on time. Also, if you say the vital signs should be done at 8 a.m., then you should be getting the vital signs at 8 a.m. and not 7:30 or 8:30, because the vital signs of the patient at 7:30 a.m. from that of the 7 a.m. and 8:30 are already different. So when you say it's an 8 a.m. vital signs, and that should be taken at 8 a.m. for us to be congruent to the doctor's order or what the doctor will do with that vital signs that you have um, written in the chart of the patient. We should be, or we are also after the consumers who are very demanding evidence-based care. The consumers, the patients, the relatives of the patient will just ask you, is this the best thing that you could do? Or is this the best medication that is suitable for my patient? Or are your interventions evidence-based or not? So we should be very careful of the relatives of the patient and the patient as well, because there are times that they know better than us. Okay. Nurses may play a variety of roles in research, including the following. As what I've told you, you could be an informed consumer or reader of research. You will just be a reader of the findings of other people, or you could be a participant, you could be a respondent, or you could be writing, you could be a participant in a journal, you could be a co-author in a journal or a research study. You could be a contributor to systematic review, or if you have done a research that could be contributing to a systematic review and you are a contributor at that. Or you could be a data collector for a research project. Like for example, before Ateneo hired us or partnered with us with Ma'am Only Navalta. We are the data collector of Ateneo de Manila on the DOH warehouses in the Philippines. We actually go to the different RHUs in La Union and in Region 1 and to the DOH warehouses to check if the medications were uh, that are for the government or from the government are given to the patients or not. So we have noticed a lot of discrepancies. For example, in giving amlodipine, okay, for a patient with high blood pressure, the midwife or the nurse would just give the patient 10 tablets and then let the patient pay for the 20 tablets. But then again, the tablet for that amlodipine is labeled as government property, not for sale. But then again, the midwives or the nurses on duty in those RHUs are letting the patient to pay. And those are the things that we have seen during the research with Ateneo as data collectors. Okay, we have here a principal investigator for a research study. You could be an author. You would love to be an author for research of a research study because it feels good to be an author of a research study. If you have done something that other people would not know, then you could be contributing to the nursing profession as well. Okay, we have here the methodological foundation. We have the different types of research. For the purpose, we have the basic and applied. For the nature of design, we have experimental and non-experimental. For philosophy, we have quantitative and qualitative, or for time, we have cross-sectional or longitudinal. We will discuss it one by one as we go along. We will have the experimental and then the non-experimental. We will have the quantitative and then the qualitative and even the mixed method research. And then we will have the cross-sectional and the longitudinal or the panel or the cohort design. Okay. when we say it's a basic research, it's actually a library or desk research. If you're trying to find out only um, the grieving process, for example, of families with patients died with COVID-19. Actually, if this is a basic research, what is our problem in doing this title? Okay, when we explore the grieving process of these families with patients died with COVID-19, they had PTSD, okay, the post-traumatic stress disorder, and we had to debrief them. Actually, we have conducted this study with students at Union Christian College. Again, this is just a library or desk research. That's a basic research, okay? When you say applied research, we are trying to do an action research, maybe a deeper one. You wanted to look on the effect of social support boosting interventions on stress, coping, and social support of caregivers or in caregivers of children with HIV/AIDS. So this could be a practical application of knowledge to everyday situations or to problems that are basically here almost every day. So that is an applied research, or you're finding solutions to these problems or everyday situations that bothers the nursing profession. Okay. We have here experimental and non-experimental research. So this is from the book of um, nursing research, an introduction to nursing research by Magnaye and Reantilio. Okay, but the other lessons for research will be from Hauser, okay, 2023. So for this one, for Reantilio and Magnaye, we have three types of experimental research, namely your true experimental, quasi, and the pre-experimental. For the true experimental, according to Magday and Riantilio, we have manipulation, control, and randomization. Okay, but Hoser would just tell us that this will not be termed as true experimental. For Hoser 2023, it will only be experimental, but it will be the same. We will have the manipulation, we will have the control, we will have the randomization. So when you say manipulation, when you as the researcher does something to at least some study participants. So when you are trying to manipulate something, okay, um, you are actually giving an intervention. Okay? When you say control, it is achieved when the experimenter introduces controls over experimental situation by manipulation or by applying the principle of randomization, or again the careful preparation of the experimental protocols and the use of a control group. So you will repeatedly hear the words control group. Okay, you will that will be discussed later in your experimental. Okay, for randomization, when you say random, you will not be selecting a participant or a respondent or assigning a group that you know. You have to be randomizing. When you say randomizing, uh, you are equalizing groups, okay, via randomization. So you will have to take note of the three words here. When you say true experimental, you have here the three properties. What are the three properties? Manipulation, control, and randomization. Number two, you have the quasi-experimental. So it's not quasi, it's quasi-experimental. It lacks one of the three properties, usually randomization or control groups. Okay, so you may be manipulating the independent variable. When you say the independent variable, the intervention, okay, in independent in intervention, but you will not be randomizing this to treatment groups, or you will not be controlling. Okay, so in quasi experimental, you will be manipulating, but you will not be uh, you may be omitting one of the properties, depende if it's randomization or control. For the pre-experimental research, it is called non-equivalent control group. This design is considered fundamentally weak. So in the book of Hoser in 2023, we are not already including the pre-experimental research. Okay, so we will have two again for Riantilio and Magnaye. We have three classification of experimental research, namely your true, quasi, and pre. But for Hoser, it will not. It will be just your experimental and quasi-experimental. So this one, it rarely is rarely used. Okay, rarely. Also, it's very hard to pronounce. Really, okay, rarely used because it lacks control strategies to compensate for the lack of comparison group or randomization. So it is very weak because we don't randomize for the pre-experimental research. So we have types of non-experimental research, and this is according to Magday and Riantilio, but later on we'll have the Hoser. Okay, for descriptive research, when we say descriptive, we describe. Okay, And descriptive research for Magdaye and Riantilio are done through surveys, feasibility study, case study, content analysis, correlational study, comparative study, and these are the classifications of descriptive research. But for Riantilio, in the next weeks of research, we will have an updated classification of what is a descriptive research. Okay. When you say survey, you are collecting data through questionnaires. The questionnaires could be adopted. When you say adopted, you copied it in toto. For example, it's a questionnaire from the WHO. It is a questionnaire coming from the hospital, and it's okay to adopt those questionnaires. But then again, it will not undergo validity and reliability because it's already adopted. When you say it's modified or self-made, then this should go for validity and reliability, and it should be validated by the pool of experts. When we say the pool of experts, these are the people who are expert in the field of interest or in the field of in that field where you are studying. Okay, and when you say interviews, this could be qualitative. When you say interviews, you have your structured, unstructured, and semi-structured interviews, and that will be taken later on when we discuss qualitative research, and that is what we call survey. When we say feasibility study, when you wanted to know the viability or the ability of a business venture to exist. Okay, so when, for example, you are testing the feasibility study of our birthing home at Union Christian College, when in fact we have the CHO and we have the Bethany Hospital where the patient could possibly go. So for a feasibility study, before we finally open the birthing clinic, we should be doing the feasibility study if we could be or if we will be able to sustain the birthing clinic financially, and of course the number of patients that could possibly um, seek for our help. Okay, so that was the reason why the birthing clinic was transformed into a classroom, because we have noticed that patients would just go to the CHO for a free delivery or go to a hospital, to ITRMC or to Bethany Hospital, rather than going to our birthing clinic. For a case study, it could be quantitatively done or qualitatively done. When we say case study, actually in quantitative, it is called as, or in experimental research, we call it a single subject study. But for a case study, when you're trying to have an in-depth investigation, for example, if you are doing a quantitative research, um, if you are studying a person or the effect of a therapeutic intervention to a person, like for example, uh, they have forwarded or they have told you that apatot could possibly cure cancer, and you are observing a person or the cancer patient drinking apatot, and that is a case study. When you do a case study for a qualitative research, for example, you wanted to know what are the experiences of a nurse suffering from HIV, and that could be a case study or observing that nurse who suffer from HIV and doing an in-depth analysis of the situation. So in a case study, you have the ability to see the changes in the respondent or in the participant, because you are only focusing to one intervention, to one participant, to one phenomenon, and to one respondent. When you say content analysis, it investigates documents for purposes of dissecting messages that embodies in them. So when you say content analysis, these are done actually for um, higher level of thinking, kasi we usually do content analysis basically when we read your case studies, but for research purposes, when you're trying to investigate documents, or if these documents are, for example, um, plagiarized or just be reproduced, and these are not really the documents that we're trying to, for example, the chart of patients. How would we know that the charts of patients in the records of the hospital are really the charts of the patients when they were admitted and they are not replaced by somebody else? So that's content analysis. When we say correlation, from the word itself, it's relational. Okay, when you try to see the effect of one variable to the changes in another. So when you say correlational, descriptive correlational, you're actually studying the relationship again of the changes from one variable to the other. When you say comparative study, when you examine several intact groups to identify the differences between them in a certain dependent variable. So when you say comparative, from the word itself, you're comparing two groups, okay, and you're trying to study particularly on dependent variables. When you say developmental research, if you wanted to propose something, like for example, you wanted to study on the impact of disaster preparedness of nursing students to Union Christian College, and you will be creating a program out from this, and that is considered as a descriptive developmental research. Okay, because you're trying to come up with a tool or um, for example, a proposed intervention or for policy recommendation purposes, so that it's developmental in nature. When you say evaluative research, when you wanted to test the quality, effectiveness, and efficiency of products, treatments, and or procedures or methods. So you wanted to evaluate if, for example, the LAMACE method will be of help to patients or parturients or a woman in labor. Or, for example, you wanted to see the effectiveness of a sambong or the efficiency and effectiveness of sambong to patients with cough without giving antibiotics, and that could be done by evaluative research. But then again, that is somehow like an experimental research. But you have to be very careful of what you wanted to evaluate, because that could be in a form of experimental research. Okay. Demonstration research for Reantilio and Magnaye, it shows how already developed products, treatments, or procedures or methods could be applied to specific situations or conditions. It talks about generalizability. When you say the generalizability or the generalizability, okay, you have to pronounce that very well, of a procedure. You have to test that procedure if it's applicable to, or the applicability of that procedure to different institutions or to different scenarios. Okay. When you say explanatory or correlational, again, this is the same with the correlational research. So when you say correlational or explanatory research, you have to test again the effects of one variable to the other. So for this lesson, okay, another is problem solving research. Okay. When you say from the word itself, you are solving a problem. You are using this research to solve a problem, to understand the problem, or to find solutions to a problem. When you say decision making research, is a scientific inquiry that selects most of the visible course of action from given alternatives to solve particular a problem. When you say decision making research, it is actually for now in the book of Poser, this type of research are no longer um, uh, used, or because it is under the umbrella of other design of research. So when you say decision making, again, you have to select the best action to solve a problem. When you say natural experiment, it's an experimental study that investigates a natural occurring event that has important health consequences and is presumed to have implications on people's behavior and conditions, comparing people exposed to the event with non-exposed groups. So when you say a natural experiment, the book would say when you try to give when you try to be very early in class, okay, um thus it helps you to understand the topic or to be um more abreast with the topic, or it doesn't change at all. So a natural experiment could be done in another manner, but then again, this type of research, as what I've told you, are no longer used during this time. So we will have to have the research or the designs more precisely in the next video. So I hope to see you once again. For this lesson, you have known the importance of research, the definition of research, its importance to the nursing profession, on what the nurse will do with research, okay? Or the types of research, basically by purpose, by time, or by philosophy. Okay, so you have known the different type of research. But then again, in the next videos for week 2, week 3, and week 4, we will be studying one by one what are now the updated designs for quantitative, qualitative, and mixed method research, or for experimental or non-experimental research. I hope to see you once again in the next videos. Thank you.